So breast milk provides what? Nutrition and immunological protection. So according to my opinion, early breastfeeding represents both nourishment and a profound emotional connection that supports the newborn's survival. Fourth is skincare and KMC. What is meant by KMC? Kangaroo mother grave. So it can maintain, all boys please listen. So KMC is kangaroo mother grave. So it maintains skin integrity and body temperature, and especially it promotes mother-infant bonding, mother and baby bonding, you can see. So, in my opinion, KMC is a remarkable, cost-effective and highly humanized method of nurturing premature and small babies. Next is eye care. It prevents neonatal eye infections which can lead to blindness. So it is a simple but powerful intervention safeguarding a newborn's vision and overall health. Sixth component is clothing. So as we said earlier, proper clothing helps maintain thermal stability. So clothing is not merely about covering the body, but it is about ensuring survival and comfort during the critical early phase. And seventh one is observation. Early detection of abnormalities can prevent escalation of health issues. So I strongly believe that continuous observation, it is a powerful tool that empowers healthcare workers and parents to act swiftly. Eighth one is weight recording. So what is the normal weight of newborn baby? 1.5. So weight is an essential indicator of the newborn's health and nutrition status. We should do regular weight monitoring. It is like a window into the baby's growth journey, ensuring timely intervention when needed. Ninth component is immunization. So it provides protection against major infectious diseases. At birth, what immunization is given for the baby? So immunization today is one of the most cost-effective strategies in public health, offering a lifelong shield to the newborn. So therefore, I would like to conclude that essential newborn care is not only about clinical procedures. It is about respecting life, preserving dignity, and ensuring a healthy future. The steps may appear simple, but their impact is profound. As healthcare professionals, it is a solemn responsibility to practice and advocate these essential care measures for every newborn every time. Let us champion essential newborn care practices to secure every child's right to a healthy life. Thank you for your attention.
Announce what is going on.
Thank you, Abhisama. Now, I want Mrs. Sangeeta ma'am and students to present their topic.
So good afternoon, dear students. Today we are conducting a workshop. Please be quiet. In that workshop, essential newborn care, right? Right? No sound. You had it, right? Okay. So essential newborn care means we have to give care for the baby, right? So before caring, baby should be there. So pregnant lady should be there. So a small skit will be there for you people. For that, cooperation is very important. Okay.
I want to see my husband.
That is the second. What is going on inside?
So here, already ma'am has taken brief introduction about the stages of labor. Small introduction I will give. Here we are having the 4 stages of labor. First stage of labor, second stage of labor, third stage, and fourth stage. Okay. In first stage of labor, there is a two pains. One is true labor pain, one is false labor pain. So here we are not considering false labor pain. Here we are considering true labor pain. In first stage of labor, it starts from true labor pain and the full dilatation of cervix. Full dilatation of cervix means the cervix will get dilated till 10 centimeters. Okay. So second one is second stage of labor. In second stage of labor, it starts from full dilatation of cervix and expulsion of the fetus. Okay. In third stage of labor, as soon as the baby will get delivered, from that time to expulsion of the placenta and other remaining membranes. Okay. In the last stage, what will happen? That is the observation stage. It will stay for 1 to 1.5 hours, depending upon the condition of the patient. Okay. So now, Alina, can you join with me? So here, the patient is inside. Now she will be having the labor pain. So now the sounds will be there. So here, steps of labor will be there. The labor has started. Here, the labor has started. Steps of labor will be there. So listen. Steps of labor. This is the pelvis. Listen. This is the pelvis and this is the. Listen. This is the. What is it? Baby. So first one is steps of labor. So many steps are there. First one is engagement. In engagement, the fetal head. This is fetal head is touching the ilioepithelial eminence. Okay. Again and again I am repeating, the fetal head is touching the ilioepithelial eminence, that is engagement. After engagement, it is going inside the pelvic inlet. Okay. Next one is descent. Descent means this fetus is going inside. Okay. Understood? This fetus is going inside the brick. Okay. Next one is fluxion. Fluxion is the sense this fetal head is touching the pelvic floor. In descent, there will be a continuous uterine contraction will be there. There will be a continuous uterine contraction will be there. After fluxion. Fluxion means the fetal head is touching the pelvic floor. It is touching the pelvic floor. Okay. After that, what will happen? Internal rotation. First, I have told the fetal head will be there in the ilioepithelial eminence. But internal rotation means 1/8. 1/8, it will take the circle and it will come behind the symphysis pubis. Understood? It will come near the symphysis pubis. After that, morning only have taken the class. After internal rotation, then what? Extension. Extension of what? Only fetal head. Extension of fetal head. After extension of fetal head, what will happen? First anterior shoulder will get delivered. After anterior shoulder, the first fetal head, then anterior shoulder. After anterior shoulder, whole body will get delivered. Okay. Understood? After the expulsion of the fetus and next expulsion of placenta will be there. After expulsion of placenta, then again some observation. Now again the baby will get delivered. Wait for 2 minutes.
Slowly. You are a patient now.
Good afternoon, ma'am. As soon as labor finished, baby should be received for the pediatric department. Then we'll start for essential newborn care. In that essential newborn care, there are certain components. In that, after receive the baby, suddenly we start drying the baby. First step is drying the baby. Drying of the baby should start from the forehead, face, thoracic region, abdominal area, lower limbs, and the genital area. As soon as this portion is finished, directly we turn the baby for the left side and we will clean for the back area. As soon as drying finished, we replace the wet towel for the new soft and warm towel. Next step, positioning the baby. Baby should be kept on their back or tilted to one side. Baby should not be kept on prone position. baby should be kept on supine position or lateral position. After that positioning, we directly go for suction the baby. When babies are born, they need to clean their mucous area to clean the amniotic fluids from the nose and the mouth. After suction, we directly go for evaluating the baby breathing and the skin color. After evaluating baby's breathing and skin color, we directly go for assessing of baby's heart rate. Normally, the baby heart rate should be 100 to 160 beats per minute. If necessary, if heart rate is less, as soon as assessing, we directly go for assessment of Apgar score. Apgar scores, in that Apgar, A stands for appearance. Nurse will look for any congenital abnormalities and skin color. If there is fluid discoloration, baby is distressed. If there is no congenital abnormality, we will go for P. P stands for pulse. Last we look for apical pulse. And G stands for grimace, facial expression. When baby is crying spontaneously, the baby is having sufficient amount of breathing. And A stands for activity. If baby's limbs are moving, so baby's muscle tone is good. And R stands for respiration and reflexes. As soon as Apgar score is normal, the normal Apgar score is up to 7 to 10. So if Apgar score is normal, directly we go for mummification and keep the baby warm. By doing mummification, we can prevent hypothermia. So hypothermia is the silent killer of the neonatal death rate. So this is the technique we call as mummification. So this mummification will prevent from hypothermia and most probably it will be decrease neonatal mortality rate. This is how we are doing mummification. And next step, we are going for care of eyes. By doing neonatal eye care, we can prevent infection of eyes and ophthalmia neonatal. Care of eyes should be done through a cotton swab and sterile water or normal saline. We have to clean a normal saline and we have to clean only once. For each eye, we should use sterile, fresh, new cotton swab with normal saline or distilled water.
The baby is very active. Baby is cute also.
After care of eyes, next step, secondly we are going for care of umbilical cord. As we are cutting umbilical cord, the care of umbilical cord is necessary to prevent umbilical sepsis. Care of umbilical cord should be done through a proper antiseptic solution.
You are not cleaning properly, it seems.
Baby's protection. After care of umbilical cord, thoroughly we are doing mummification.
Baby cute does. sister is very serious.
Mummification should not be delayed to prevent hypothermia. After mummification, we directly hand over the baby for kangaroo mother care or breastfeeding to the mother. And next, our last step of the essential newborn care, kangaroo mother care or breastfeeding to the baby. Hand over the baby for the mother for breastfeeding. And here we are teaching a breastfeeding techniques
Come here,
for the
make her to
mother.
sit center. One will remove screen not left enough. We'll remove.
So these are the certain breastfeeding techniques.
Ma'am, please come. Delivery over, baby bath over. Technical so. No. Don't place.
So these are the steps including breastfeeding. So here we are including essential newborn care. Mother can take happily.
Next baby. Remove this bench. Now ma'am, you'll present now or sir? Just 2 minutes.
So now we are starting pediatric life support. So now we are starting pediatric life support module. So pediatric life support should be initiated when a newborn exhibits signs of distress or failure to transition or breathing difficulty as after birth. Once we receive distressed baby or difficulty breathing, so once we receive the baby, we'll try to assess the baby. If baby is crying or not natural check, if baby is not crying, we'll give a stimulation to cry. Still, after stimulation, if baby is not crying, we'll directly assess heart rate. Heart rate should be assessed for 6 seconds by taping the leg. After 6 seconds, if the nurse will receive only 8 beats per 6 seconds. It's nothing but will multiply into 10. So it is up to 80 beats per minute. So after 80 beats per minute, we'll start positive pressure ventilation. So normal heart rate of a newborn is 100 to 160. The baby heartbeat is 80 beats per minute. First, we'll directly start positive pressure ventilation. After one round of positive pressure ventilation, again we are assessing heart rate for 6 seconds and then we'll multiply into 10. for 6 seconds. Now she assessed 100. Now she is getting only 7 and heartbeat for 6 seconds. It's up to 70 beats per minute. So now we are going for correction steps for breathing circle. In that correction sections include MR SOPA. M stands for mask adjustments. R stands for repositioning. R stands for repositioning the airway. S stands for suction. S stands for suction. Suction the airway. O stands for open the mouth. O stands for opening the mouth. P stands for pressure increase to the ambu bag. A stands for artificial airway. By doing these things, if we are not getting saturation, we will do artificial airway and we will make the baby getting artificial circulation. After MR SOFA, again we are reassessing heart rate for 6 seconds. After 6 seconds, if she receives only 5 beats for 6 seconds, until heart rate comes for less than 60, we are not doing any compression for the baby until heartbeat reach for 60. So now we are starting compression at the rate of 1 breath per second. After 3 successful compression, we are giving 1 breath. After 1 cycle, we are again reassessing the heart rate. Again for 6 seconds, if baby heartbeat is only 5 or 6 seconds, so we multiply to 10, so that is 50 beats per minute. So after compression and circulation, baby heartbeat is not rising, we are giving adrenaline or already preferable secured umbilical vein, adrenaline 1 mg. After that, again we are starting positive pressure ventilation and positive compression. After successful one cycle, after that again we are checking for heart rate. Now she is receiving 10 beats for 6 seconds. It's up to 600 beats per minute. So it's up to heart rate is reaching normal. So now we are doing mummification and handing the baby to the mother. So by here we are completing pediatric life support. After mummification, we are handing over the baby for the breastfeed.
Thank you, sir. Now I would like to welcome Sri Premalata ma'am, Nursing Superintendent of Seo Hospital, to give an awareness about breastfeeding technique.
That bucket and tables you
Evening. From morning to till everyone is locked up for the class. Okay, also starting the session, we do one exercise. Okay, my students, can you stand 5 minutes? Very good.
Screen.
Everyone
Farshan,
I request
Screen
hands
also.
of boys also.
Girls.
Stand up, stand up. We'll do one activity, okay? Now, everyone? Are you sleeping? Sleepy mode? No, right? Okay. I'll give one question. Okay. Okay. This is A. Okay. This part will be A, and this part will be B. Okay. And okay, for A, I'll say hand raise. Okay. So and B, you down your hands. Okay. Hand raise. Hand up, hands up, hands up, hands up, hands up,
They didn't
hands
had
up,
they didn't had
hands
lunch.
up, hands up, hands raise, hands raise, hands raise, hands up, hands raise, hands up, hands raise. Do no, why? Now hands up. Who is hands up and who is hands up? Huh? No one. Hands up. Hands up. Hands up. One of the boys. Hands up. Who is hands up? Hands down. Hands on. Who is? No one. No? Maybe gone. Huh? Sit. No one. Sit.
After the task, they became disoriented.
Don't worry, I don't take too much of time. I know because I have some yourself only, okay? Let me ask some questions, okay? I don't take too much of time. Only 15 minutes you can give me. No? So, what is the technique? Do you know? It is only huh? It's okay. Good. Come on. What is technique? Anyone? What is technique? Huh? What is technique? Anyone, any idea? Huh? Tell me, how to feed the baby? Very good. Okay, what is technique? I must say, what is technique? It is mother technique. Good answer. So, technique in the sense, how the baby we need to hold and how we are going to feed the baby. Okay. So, this training period will be difficulty when you come to the clinical side, no, when you are the patient side, no, patient side. At that time, it is very useful for you people. Okay. So, there are certain breastfeeding techniques are there.
Madam, you can go on.
So about the breastfeeding, is it human breast milk is the healthiest form of milk for babies. There are a few exceptions such as when the mother is taking certain drugs or is infected with human B, lymphocytic virus, HIV or has active instead of tuberculosis. Nowadays, if this mother is having tuberculosis, HIV, HCV, and positive, she can feed. Okay, but certain precautions she should use while feeding. Okay.
Take the chair and sit here only. Turn laptop towards you.
Okay. So, if it is mother, she is going to feed the baby. she can lose her weight. Okay, around 500 calories she can burn herself. After the delivery, mother can become fat, and correct, no? So that time she can burn the calorie while feeding the baby. Okay. So infant feeding use bringing hands to the mouth, rooting, suckling, and licking, nuzzling, and lip smacking. So these are the infant feeding cues. Preparation. Before going to give any breastfeeding, you need to first what you do. What you have to do? Wash your hands. Okay. Next, position comfortably and correctly use pillow or towels for support under the breast. Next. So there are four positions. Okay. No.
Close it. Fan your this is fan is outside. Fan is outside. Put on the fan, huh?
Anyone can come? Anyone?
Can I come?
What's this patient name? Rosie. Okay. Going to feed her baby. So, whatever the position we need to explain to the patient, we need to see. Okay. While taking the baby, we are not supposed to touch the oxygen. Got it? Okay. Whenever you used to take like this, no, grandmas and grannies are taking like this, no babies. So feeding. Isn't that usually it's not right in the patient side? Okay, we are not supposed to hold the baby like this. Okay, we need to place both legs here. Got it? And back should come like this, and after that we need to hold like this. Okay, the ear, shoulder, and it should be in the line. Got it? The ear, tell me, ear, shoulder, and hip. It should be one line. Okay, some people will take the baby like this. Feeding. So this is wrong. Got it? This is wrong. So we need to educate the mothers to hold like this. This is 2 years baby. We don't want. Okay. We'll take you all. So your hand should be neck support. Okay. How we are going to hold the neck? Like this only, not like this. Got it? See, this is wrong. Okay, you need to hold like this. So the
Sisters are too bad. They did not do just for my baby. Correct, no? After coming for AC.
Thank you.
ನಮ್ಮ ಮಗುವಿಗೆ dress
Ma'am, smile. Yeah, I usually do. No, I really show you some photos.
ಬೇಬಿಗೆ ಸ್ನಾನ ಚೆನ್ನಾಗಿ ಮಾಡ್ತೀರಾ See, baby is walking.
Like this, I will I'm comfortable.
Breastfeeding, usually we recommend for the patients four position. Okay, one is right foot ball and left foot ball, cross cradle and sleeping and feeding. Okay, sleeping and feeding we are not going to recommend because baby will breast will be compressed to the baby, mother breast will be compressed to the baby, so baby will suffocate it. For that only we are not going to recommend sleeping position. Okay, there are four methods. One is right football method, another one left football, another one cross cradle. Okay, so in a twin baby, what we are going to suggest? Twin babies. No? Football. What football? So that two-way position will give. Okay, two-way position. Nothing. That both sides. Mother can hold both sides and she can feed the baby. Okay. So we will take it now. You are not supposed to touch the occiput. Okay, if it is you are touching the occiput, baby will stipulate to backward. Okay, so you need to support the neck. Okay, neck, back, and support that legs. Okay, while sitting you are taking no. See, while sitting you are need to take a look. So neck, back, support. Okay. So whenever you are going to assist the patient for feeding, you need to get it in one mind. Either feeding pillow, either breast pillow, you need to support. Okay. So if this you are going to provide a right football method, you need to give the pillow like this. Okay. And then next, same as it is left football method, you can give like this.
baby's mouth. Okay, only baby will suck nipple this, mother nipple will hurt. Huh? So again, mother will come again with the complaints of what? Cracked nipple. Okay, she unable to feed the baby accurately. Huh? So this indicates skin to skin contact. Okay, so Kangaroo method that kangaroo will cover the baby like that, no? So baby and mother like that only. Okay. In a cross cradle way, what you should do is so pillow should be comes like this. Same way should and this side should be like this. Okay. So in a way like this, cross cradle method will be.
All our future mummies and fathers only to feel shy. And you're also going to nurse.
Listen, patient will explain. Okay.
All of you are going to be future mummies and daddies. All daddies should support your life for feeding your baby. Okay, no, you don't need to feel shy. Okay, and also as a nurse, you are going to assist so many mothers to feed their babies. Okay, so observe carefully and learn.
Okay, so learn the position, right? Okay, after the feeding, you need to look after whether baby is taking full feed. You need to assess. Okay, usually we recommend every single half an hour feed. The mother has to be feed to the baby. Okay, and after that she has to burp the baby. What is burping? We used to do mother. This is the way we need to do burping. So we are not supposed to tap the baby back like this, okay? We need to. So after feeding, see, we need to hold like this and head back and buttocks should be like this in a way proper, not like this. Okay. So after feeding, you need to take the baby. Sorry, baby, drop back. Okay. So turn the face like this and keep it here, and your chin will be touch baby's head and gentle rub. Got it? Gentle rub. Like this you need to. Okay, not to take like this and. In olden days they were doing like that only, right? Huh? So what will happen like this? We are doing this. What will happen? Huh? What will happen? The stomach will compress here and maybe milk will slip out. Got it? So that's why we need to put the baby, keep the baby here and our chin. Turn the baby's head like this and keep it here and gentle rub. You can sing or do something and keep it like this, gentle rub like this. Okay?
This is called burping technique.
Next step. This is actually side-lying position and side-lying position, lying position we are not going to recommend for the mothers. Okay, nowadays mothers will, I explained before only, right? So we are not going to explain the lying position. Only the three position will recommend. That is, one is right foot fall, left foot fall, and cross cradle method. Okay. For twin babies, we need to hold the two babies in hand and feed. Next. See, what can you see here? Any observation? What can you see? Huh? See, this is what and this is what. They only mention good attachment. How you are going to assess good attachment? Huh? Babies? Huh? Baby is giving the full mouth. No, this cheek will touch the breast. Okay, and mouth will be wide opening. So this is good attachment. If it is, we are going to feed like this. Mother will get cracked nipple. Okay, so she can't feed again anymore. Huh? Next. Next. So while delatching the baby, we are not supposed to take the baby like this. We need to put a little finger inside the baby's mouth, and after that, we'll remove the baby. Okay. This is perfect techniques. Advantages of breastfeeding. Breast milk has exact combination of protein, fats, vitamin, minerals, this and all you know, no? Practical session, theory only it will come. So from my part, for the babies, the first vaccination is mother's milk. Okay. So there are certain issues in breastfeeding. One is inverted nipple, flat nipple. Before we were doing the nipple exercise after 31 weeks, but nowadays guidelines we are not doing that one because premature delivery will happen. For that only we are not going to recommend the mothers. Okay. If it is flat nipple also, after the delivery she can feed the baby. So this is syringe method. These are complications, post-delivery complication. Okay. Flat inverted, poor attachment. Storage of milk. So storage of milk, human milk can be stored at a room temperature for 6 to 8 hours. Expressed milk can be stored in an insulated cooler bag like that. We don't have in Karnataka, we don't have that milk bag. Okay, only in the state only one coil or two. Okay, we don't have any more. We will transfer it, but we don't have. Steps to successful breastfeeding. One is it is a all mother and baby sponsor will be included here. Next. Thank you. Any doubts? Anyone can show more position, three position to patient Lisha? Volunteer? Anyone? Any doubts? Any doubts? Next, you're going to give the feeding to mothers, right? Huh? And practical only. Come and give on session. At least one position. Show me. How you are going to hold the baby, we'll see. Anyone? No? Can you show me?
Actually, I forgot whatever the positions madam has shown. Can you please read them on screen to me? I forgot the procedure. Can anyone read them on screen to me?
How many positions are there? Oh, okay. Which put your hands together to get a shot. Thank you so much.